Welcome to the Wildlife Health Talks. This is the 76th episode introducing WDA members and their amazing work all over the world. And my guest today is Dr. Andrew Hill. Andrew is a senior veterinarian at Currumbin Wildlife Hospital on Queensland Gold Coast in Australia. So yes, we are in Australia, both of us for a change. For 20 years, Andrew has been a wildlife vet and he currently works at one of the world's busiest wildlife hospitals, treating over 16,000 animals every year. I can't even imagine. How is this even possible? But instead of just managing the crisis, he decided to find out what the world's best hospitals are actually doing differently. Earlier this year, Andrew completed a Churchill Fellowship, visiting 10 major wildlife hospitals across Brazil, the US, Canada, and the UK. He brought home insights that could transform how Australian wildlife hospitals operate, from triage design to staff burnout to prevention strategies that actually reduce admissions. Today, we are talking about what he learned and what it means for Australian wildlife health. Welcome to the show, Andrew.
Hi, Pat. It's great to be here.
Andrew, starting with some WDA questions, as we usually do. When did you join the WDA?
I joined as a student at Sydney University as a veterinary student, but it actually took me 10 years before I made it to a WDA conference. So I feel like I've got a lot of catching up to do.
You're there now, so that's awesome. What's your favorite WDA-related experience?
I think when I finally did get around to a conference, it was the international conference on the Sunshine Coast in, I think, 2015. And just having the whole Australian wildlife community in one place and seeing the breadth of work that's being done is really inspiring. There's so many people with amazing skills working together to achieve great outcomes for wildlife. So yeah, I really enjoyed it.
That's great. I did hear about this conference by now 10 years ago. I didn't make it, but it seems to be legendary. Let's jump into talking a bit more about your work. So I mentioned the Churchill Fellowship already you completed. What's the purpose of it? Can you give us just a brief overview for everyone, including me, who has never heard about it before?
So Churchill Fellows travel overseas to investigate best practice in any area that they have an expertise in. And the aim is to then bring new ideas back to Australia as a substrate for positive change. So in my case, that was looking at the largest and busiest wildlife hospitals in the world so that we could improve our wildlife health system in Australia. It's their travelling scholarships granted by the Winston Churchill Trust, obviously in the memory of Sir Winston Churchill.
That's awesome. And did you actually have to look up or ask colleagues about which ones are the busiest wildlife hospitals worldwide? Or having worked in this field, was that something you knew and you were straight away, no, I'm going there and there?
I had a long list of dream hospitals that I really wanted to visit. So I actually had to set out really strict criteria to make sure that we got the best and those that were going to contribute to changes that would really help the Australian system. And so we had, set restrictions on which places that we would go to. And I was really lucky that everyone wanted to be part of this project because we hadn't joined these hospitals together before. We hadn't shared a lot of this information. So it was great that people were really happy to partner and share.
Sounds like a great time visiting all those places and meeting all those people in person. I'm a little jealous, I have to admit. Then maybe a funny question, but I have to ask it anyway. Was there any, let's say, restrictions comparing the different hospitals in different countries, considering Australia's animals, thinking of marsupials, are so special? Or is that something like, no, the type of patient doesn't actually matter, it's all about organization?
In my biased opinion, Australian animals are the most quirky and unusual and wonderful species in the world. But every continent has its own unique wildlife. So sloths, for example, fill a kind of similar niche to what our koalas do. So there are many similarities. For our purposes, I did stay away from large African wildlife because that kind of outdoor work is very different from our large capacity wildlife hospitals. But no, it really didn't matter what the species was in the end because each animal was a unit that needed to be admitted, it needed to be cared and housed. And it was more about the organizational process that actually put them all together and less about the species. But it was a massive highlight seeing just the breadth of species that vets around the world get to treat.
Very cool. And so you visited 10 hospitals across 4 countries. What was the most surprising thing you discovered?
The most surprising aspect was actually that this was a 75,000 kilometre round trip. And yet, at the end of the day, we're all in the same boat. So it doesn't matter what your location is, the culture that's driving your practices, or the species that you're treating. Admissions to wildlife hospitals are rising globally. And so this is a global challenge. It's not something that is related to our local environment. And the majority of the cases that are coming into these hospitals are there because of human-induced change. So it's our impact on wild environment that's causing the busyness of these hospitals to increase over time.
You mentioned the human encroachment basically on wildlife habitat, which is continuously increasing. What about a sensitivity of people and maybe the interest and willingness to pick up those animals that look injured and bring them into hospital? Is that also something that has increased?
As a small hospital turns into a large hospital, there is a aspect of visibility. People know where they need to take wildlife, so they're more likely to take it to a referral centre, to the wildlife hospital, than perhaps to their local vet. But that's the middle period of a hospital's development. By the time they get to the large scale that I was investigating, basically all the wildlife is pouring into those hospitals from quite a large geographic area. And that was what the study was about. When we get to that size, how do we manage that while maintaining the quality of the work we do for the animals, but without burning out the people that are working in these institutions?
Yeah, really good point. And getting to the next question. So, your report that you completed as a result of your fellowship is called Prevention, Partnerships, and Preparedness. So, making it hard for you in one sentence, what's the core message you found?
My core
You can
message
use
is
two, it's fine. Two sentences is okay too.
I'll take two, but the core message is that we're all in this together. So adopting collaborative long-term strategies is what is going to produce results rather than reacting as individuals. And as a second sentence, it's the long-term strategies that allow us to holistically care for the people in the wildlife hospitals as well. So if we react on a day-to-day basis, that's where we start to see the stress and the burnout in the staff. And those long-term staff really are the ones who are developing the expertise and improving the quality of the care that we provide.
Nice. That is really cool. I really like that. And let's dive into some individual experiences you had in the US. You met Dr. Renee Schott at the Wildlife Rehab Center of Minnesota, and she triaged 60 cases in under 2 hours. Incredible. How did she do that? And what does it tell us about hospital design? What was her secret?
So this was a really exciting part of the fellowship. So this is one of the busiest hospitals that really peaks in its summer. Renee was delightfully clear-headed and efficient in the way that she had organised the hospital and had really thought through the process from both the human point of view and the animal point of view. And so I got to join, it was actually Agnes Hutchinson in the treatment room on a morning where animals were just flowing in the door. And the way that we triage such high volumes of animals is by removing all of the barriers that take away from the core job that the vets are doing. So in their treatment rooms, they have real-time capacity for how many animals they can accept of different species. They have black and white guidelines for triage. And they've mapped out all of the treatment pathways. So you still retain the creative ability to treat individual animals, but all those conversations that take time and effort for the veterinarian have already been done. So all the vet needs to do is assess their animal, decide whether it's going to be admitted into hospital, and provide the treatment, the early treatment that's needed. So it's a very efficient process simply by having those conversations earlier in the piece.
You mentioned that it's not taking away from the creativity. Not at all. Isn't there a risk that it does? I could imagine that some people hearing that, like, I'm not a clinical vet, but people who would be hearing that might be like, oh, then I don't have the freedom anymore to do what I think is right.
Yeah, there is this balance between efficiency and autonomy. So when we have maximum autonomy, we can make individual decisions per animal. But what happens when your caseload gets that high, you end up with decision fatigue. So making those individual decisions across 60 animals is really fatiguing and taxing, and that's not a nice place to be. So what they do is sit down and discuss ahead of time what their intended treatment plans are going to be. And to a certain extent, they standardize them, but it means they've already agreed on what they would like to do in certain cases. So it's not taking away the autonomy and being told this is what you must do. You've actually been involved in the process and agreed that, okay, this is the best path for an animal based on the data that we have, which means you're now just left to execute that. And so it's not a robotic, let's just follow the list, but it's your process already worked out. So you have the freedom to just continue on. If you think about all the difficult conversations you have to have in veterinary practice, that takes an extraordinary amount of time and more time than the clinical work. This means we get to take those and have them already decided, and you can just get on with the job of fixing them. And so every animal remains unique in the wounds that it's sustained or the illness, but now you can just put your head down and work away. And that's quite liberating.
Yeah, no, that sounds really smart. And I could imagine that might also be good guidelines for early career vets who might not have the experience, especially with wildlife, to, yeah, get support in their decisions.
Yeah, it really helps with the training because there's somewhere that those students or new vets can actually go to and see, okay, this is what these experienced vets have been doing, rather than every case having to go and ask and find someone. I remember when I graduated, so much of the knowledge was in people's heads rather than written down. And you have to find the person who was great at echidnas and give them a phone call and say, what do you do in this situation? This is more about gathering that data ahead of time and writing it down so it's there. And that's fantastic.
All right, let's talk about preventing burnouts in the staff members. So that was one big part of your report and your study. So you looked into that. What are the best staffing ratios and what, I guess, causes and prevents burnout? So what are the specific recommendations that you're making for Australian hospitals in that regard?
Yes, wildlife professionals are working in really hard circumstances. So they have to make life and death decisions about their animals. They have to have difficult conversations with the donors or carers of those animals. And I think we often put a lot of pressure on ourselves because we care about the patients that we treat and the work that we do. So I interviewed the different managers of the hospitals and those staff who were in at-risk roles for burnout. So people who were on the front line on front reception or in the middle of the treatment room. And we worked out what safe staffing ratios actually look like. So for a veterinarian, around one vet per 15 cases per day works out to have effective treatment for the animals, but also to effectively support the vets. But the reality is, currently vets are treating up to 60 animals a day. And if we let them go, then they certainly will. But in human medicine, after we came back, we looked at these numbers and thought, is this really realistic? So we compared it to human data. And when human emergency doctors treat more than 20 cases a day, the mortality rate of the hospitals, the 7-day average, actually increases. So we think this is more about the decision fatigue than it is about expertise. It's not saying that vets can't treat more, but it's saying that at around 15 cases per day, then that's where you're able to make great decisions for those animals and protect yourself from burnout. So this is really helpful for managers to not just look and see, is my vet coping today? It's about what's going to be best for my vets long term. And not just veterinarians, for nurses who do so much of the caring work and the really get these animals through their critical stages. We need to have usually double the number of nurses as we do vets in the triage and treatment areas of those hospitals because they're in very high multitasking roles and that can lead to burnout much more quickly. And the third aspect of staffing was the need for administrative capacity. So if all of your staff are medical staff, then when everyone's diving in to respond to an emergency, there's really no one to support those staff. So having your administrative capacity to look after the hospital and look after the people while you're in the breach doing your amazing work, that is what provides stability and support within the hospital.
Yeah, that sounds amazing. You have also looked into ways to reduce admissions in a positive way, right? Not just tell people to ignore injured wildlife. I guess that would not be a very smart solution. You found that many overseas hospitals prevent admissions through hotlines and public education. Rather, how realistic is that approach for Australia and what would that look like?
Yeah, overseas hospitals are really front-loading their efforts. So looking at their local environmental policy and their intake strategies. And there's efficiency gains all the way down the chain from there that happen when you develop a really good intake. And they're focusing on real world outcomes, because if we continue to treat these rising levels of admissions, we're not going to achieve great benefits for the animals going back out into environments where they will come to harm. And they did this in a couple of different ways. A lot of the outreach is based on that first telephone call when calls are coming into a hospital. And they see that as a chance to educate and provide a preventative message so that they can create real change in the environment. And some of these teams were teams of 5 and 6 staff members whose focus was on communicating effectively to their city so they could make positive change while the clinical veterinarians and nurses are doing their job and the rehabilitators are doing their job. So there's a huge capacity in Australia to work preventatively rather than reactively. But this is a huge country. And when you look at how well spaced apart our veterinary hospitals are, an individual hospital can't have the kind of impact we need on a national scale. And so it's communicating effectively and closing those gaps that's really going to make a difference. And when I mentioned earlier that the majority of the causes of admission are human induced, that means we need to get out and connect with people and change behaviour, whether through public opinion or public policy, so that we can stop these animals coming to harm in the first place.
Yeah, that sounds really good. But I guess the question is, does a wildlife hospital necessarily have the capacity to do outreach as well, right? Next to all the other tasks they are already doing.
It depends on funding, but you can also do this in a smart way. So some hospitals who had the funding had outreach and education teams so that they could directly influence the caseload that was coming into the hospital. Those hospitals that didn't have that kind of outreach instead looked for collaboration and partnerships. Often a wildlife hospital doesn't have a large enough voice to project beyond their local area. And so by partnering with advocacy groups, with local government, they could get the message further and amplify it in a way that went beyond their own professional capacity. So we're vets and nurses, we love treating individual animals, but we're certainly not presenters, and we're not often the best advocates for our own work. And so by combining with others, you can actually scale this up to achieve great things. And Toronto Wildlife Centre joined with advocacy groups and the local museum actually to display the problem of birds flying into windows. Toronto is in the middle of a migratory flight path. And so they actually managed to change the local building regulations so that now Toronto must have the lights off during migratory periods on their skyscrapers. They changed the style of the buildings that they build, so you can't have linear designs that put birds at risk, and they have to have bird deterrent windows. And that's not something that one hospital could do, but they played it smart and connected with people to be able to do that.
That is very cool. It's in a way sounds like such an easy solution, but then you have to find those groups and connect with them and put the work in. So it is a lot of effort, but that sounds really cool. And what an impressive outcome that they managed to, introduce the rule to have the lights out in the skyscrapers. That is amazing.
It's
Nice.
fantastic, and it feeds back into what they do because that's positive encouragement. So you achieve some goals, and that in turn spurs on your team, and it becomes a snowball, and you get greater and greater impacts in your environment. And what I'd like to see in Australia is for us to have more of that so that we can start that groundswell and that awareness that we can actually make a difference and we can make change for a better future for our local cities, but also nationally.
Nice. And I guess, as always, the more people work together, the more likely and the easier is it to make a change, right?
That's exactly right. And it's more fun.
Exactly. That is very true, which then helps with burnout. It's all connected. I love how many amazing personal interactions you had on your trip. During your visit, you spent time with Carolyn Good at Vendl Wildlife Hospital in England. What impressed you about her approach to wildlife rehabilitation?
So Carolyn Gould is a rehabilitator with 40 years of experience. She is a member of the Order of the British Empire, and she started Vale Wildlife Hospital, which is in England's northwest. And she had a very clear focus on the experience of animals as they move from rescue through treatment to release, and how we apply the foundational skills to ensure that animals move through that process quickly but also effectively, so that the animals are less stressed and that their experience isn't going to affect their release prospects. The other element that really impressed me with Carolyn was She had mentored this team for many years, and so had really moved those skills out there into the real world to amplify her impact. And when I asked her, what is it that we actually need? So if I had a message to the veterinarians of the world, what is it that we need to improve, particularly triage for wildlife? And her perspective, which was echoed by rehabilitators across the globe, is that having a clear understanding of the ecology of those species, so how they hunt their prey, how they avoid capture or survive through the winter, is really critical at that point of triage. We can make good decisions about the animals that we treat, and we can address their needs appropriately for that species. And this is a challenge because we can see over 300 different species. And she really encouraged the vets and nurses to get out of the hospital doors and get to know and love and understand those wildlife as healthy animals. Because the better we appreciate their lifestyle and the way that they work in the wild, the better we can accommodate them in hospital. I think often we're focused on the anatomy and the physiology of getting it right, but really opening ourselves up to those non-veterinary skills and understanding allows us to target our treatment, and I think it actually increases our ability to have compassion for these animals when we know what their experience is out in the wild compared to in the hospital.
That's awesome. And again, two birds with one stone. You get staff members out there into nature, which is always good for mental health.
That's right. There is this dichotomy of efficiency and compassion. If you don't have efficiency in these large caseload hospitals, you don't have time for compassion, because compassion does actually take time. And you don't have time for the little tiny steps that allow people to care. So getting good workflows in place and having those efficient processes actually leads to more caring. But it's a little bit counterintuitive because we want to focus on that one particular animal in front of us. But when we get those kind of numbers, we need to go in with a plan.
Yeah, very cool. We have already talked about several measures that could be improved or implemented, but say if you had three things from your fellowship findings in Australia, like what would you, if you could implement three measures in Australia, what would those be? Like really briefly summed
I
up.
love this. I can tell you that straight off the top of my head. So the first is to know what we don't know. The second is to use what we do know. And the third is to leverage that so we can support our people. And I'll explain what that means. So to know what we don't know, there's very little post-release monitoring in wildlife medicine, which means we don't know if we're actually meeting the long-term welfare needs of these patients. So our immediate need is to fill that gap, because that will provide the feedback so that we can improve our treatments to know whether we're even heading in the right direction at all. The second, to know what we do know, is actually gathering that data. So getting things out of people's heads and using what we know. We generate huge amounts of data in the clinical work that we do with wildlife, but often it sits unused. So in some reasons for that is simply the busyness. And the other reasons are the lack of standardization between hospitals so that we can turn this into big data. So we really need to start standardizing and making use of our data so we're a science-based community making better decisions based on the numbers of the animals that we treat. And the last is that hospitals don't exist without people. They are run by staff, but also by huge amounts of volunteers. So unless we care for those people, we're not going to generate the growing knowledge and improvement over time to make our job easier. It's going to be this hard forever. So we really need to focus on our people first and support them so that they can support the animals. And that comes down to safe staff ratios. It comes down to the operational funding of these hospitals. I think in Australia there is a big mismatch. We can build great buildings, but we actually need a lot of funding to do the work in those buildings, because that's where the real magic happens.
Very cool. Now you're back at the Currumbin Hospital and there is some change afoot. A collaborative research and education facility is currently being built. What's going to happen there?
So we are building a research and education facility here at Currumbin. Rather than expand our treatment space, we're trying to expand our preventative influence. There's two wings. One wing is a molecular lab. So we're trying to connect the scientists more closely with the wildlife that they study so that the answers that they gain through research are actually going to help those animals. At the moment, there can be a gap between what's academic and the real world needs of these animals. And so we're trying to bring them together so that when students and researchers are actually investigating, they can go that extra mile and provide information whether to improve our treatment or to improve conditions in the wild for those animals, which is really exciting. The other wing is a educational facility. So from both a professional and a general public level, we can actually get that information out. Because if I learned anything while I was overseas, it was education and prevention, the platform that we use to create real world change. And so we want to bring people in, expose them to that research and those cutting edge findings, so then we can roll it out to the real world. Because it's fine for me to improve how we treat things behind closed doors in the hospital, but we need to be making an impact in the wild where these animals live. We want healthy animals living healthy lives.
Before we wrap up, one last question. You have established a sister hospital agreement with the Wildlife Rehab Center in Minnesota we talked about before. What does this partnership look like?
This was a really heartwarming aspect of my travels. Minnesota in its summer is the busiest hospital in the world. But as they've grown, they still remained curious and they still want to improve and they want to work collaboratively together. So this sister hospital is about sharing knowledge. It's also about sharing staff. Their summer is our winter, so it's the perfect opportunity for staff from each hospital to cross-train in the busy periods of the other hospital, which we've always wanted to do in Australia, but it's hard for people to leave in the busy periods. So this way we can increase the skills. And the third element is that these hospitals are large, complex organizations. And increasingly, there's much larger investments that are required to make the gains that we need. And so having an international perspective can really let us plot out what our future needs are going to be, particularly with hospitals that are so much further ahead, such as Minnesota. And that can help us make good decisions that care for the animals of the future and care for our staff into the future, which will help everyone grow.
Talking about the place where you're back at now, where you work, the Currumbin Wildlife Centre in Australia, there are exciting plans coming for 2026, which will mark the start of the building of a collaborative research and education facility. What will happen there once it has been opened?
So this is a really exciting process. We've always wanted to move into the preventative space so that we can make real world change. Because as we've seen cases are rising worldwide, we're going to be treating animals for a very long time, but we need to start preventing it. So the research and education facility has two wings. One is a molecular lab where we can bring scientists in and connect them with the animals that they're studying, not just in an academic way, but so they can understand the needs of those animals. And the results of their research can contribute to either improving their treatment or to real world change that will support healthy animals in the wild. Often, there can sometimes be a disconnect between academic research and what's needed. And so we're trying to bridge that gap and make it translational. The other wing is an educational facility so that once we get that information, we can then share it both in professional circles and in a public setting so that we can actually roll this out and create change in our city. So we're very excited. Often these are skills that are beyond our treatment rooms. And so it's great to bring people in and provide the facilities that they need so we can do it together.
That sounds awesome. Thank you so much, Andrew, for being my guest on the show and for sharing the story of your massive trip and travel. Sounds like you had a great time and the results just sound awesome. So I feel like I have to visit Currumbin at some point in the near future and check out what's happening in this space.
You're always welcome. It's been fantastic. Thanks for chatting.
Thanks for listening to the Wildlife Health Talks. We will be back with a new story in 2 weeks. Bye for now.